So today's video is the continued lesson from last video, which is about basic treatment and care, and the second point after taking a temperature, which is taking a pulse. So pulse is created by the rush of blood through the arteries each time the heart beats or pumps. Pulse readings determine a person's heart rate, which is especially important in emergency situations. The normal heart rate is approximately 60 to 100 beats per minute in adults and 120 to 140 beats per minute in children. So variation in heart are caused by exertion, time of day, emotion, or pain and fever. A pulse can be felt in certain places where the arteries come close to the surface of the skin, and the wrist, neck are the easiest place to feel a pulse. So when taking a pulse, use the 3 middle fingers because they are the most sensitive, and do not use the thumb because it has a small palms that may interfere with your reading. When counting the pulse speed, notice any variations in speed or pauses between beats. So follow this step for taking a pulse near the wrist. 1. Find a watch with a second hand or a digital readout. Second, ask the person to lay his wrist on a table, palms side up. Third, place the 3 middle fingers across the surface of the wrist and each from the thumb. And fourth, locate the palms and count the number of beats for 1 minute. And if this is used for the neck, so follow this tip for taking a pulse on the neck. 1 is tilt the person's head to one side. Second, place the 3 middle fingers under the jawbone by the Adam's apple and slightly move the fingers under the, move it slightly down. And third, locate the palms and count the palms beats for 1 minute. And our third point, which is about taking a blood pressure reading. So each time the heart beats, it pushes blood through the body. The force exerted by the blood on the walls of the arteries as the blood is pumped the circulatory system is called blood pressure. And blood pressure is a very important part of medical health. If the pressure is too high, it can result in damage to the arteries. So blood pressure is measured in millimeters of mercury. It is expressed in a ratio of systolic pressure over diastolic pressure. So systolic pressure is the blood pressure reading taken when the heart is pumping, and diastolic pressure measures the blood pressure when the heart is resting. So an example of a normal blood pressure reading is 120 over 80, and the systolic reading is 120 and the diastolic reading is 80. A normal reading for systolic pressure is between 100 and 140, and a normal reading for diastolic pressure is between 70 and 90. So blood pressure should be checked regularly. A person who has high blood pressure may not know it. Often there are no warning signs. For these reasons, high blood pressure is called the silent killer. So this is all for today's video, and I'm going to share more points about the treatments and care in the next video. Bye!